This is One on One. We're joined by Dr. Stephen Brunnquell, who is president of Englewood Health Physician Network. Good to see you, doctor.
Nice to meet you.
This is a physician network, right? $100 million physician network, right?
We're over $100 million in revenue right now. We're just over 400 providers now.
What is a physician network?
So we've taken practices, mostly they were practices prior to joining our network. They were private practices. We've brought them under one umbrella so that we can coordinate care better. We provide a lot of the infrastructure for practices because it's getting harder and harder to run a private practice. Doctors don't want to run an office. They want to treat patients. They want to see patients. They want to treat patients and make them better. So now we can share information.
How?
We have a single electronic medical record. We have all of us are now on the same electronic medical record platform. So you come to see me and you say you have some chest pain when you're on the treadmill.
Right.
And I say, okay, well, let's do this and let's get you to a cardiologist because I'm nervous about the possibility of heart disease. So I can not only I transmit that record to another doctor. I can make the appointment for you. I can send a message to him saying, hey, listen, I saw Steve Adubato this morning and I'm concerned about heart disease. Let me know what you think.
What happens to, you'll come back to that, doctor, but what happens in other situations when there isn't this collaboration and there's more of a siloed, fragmented approach to the way physician, well, I don't know who that physician is. He or she dealt with you. That's just what I'm doing. And you see, as a patient, you're like, who's talking to whom here?
That's the way I started. I mean, 25 years ago when I started my practice all by myself and I pretended to be Marcus Welby, I thought I took pretty good care of patients, but when you came to me with that same chest pain, I gave you a telephone number and said, go call this doctor and he'll take care of you. Now that doctor sees all of what I wrote. He sees your labs, he sees my notes, he sees your medical history, your allergies, your family history. It's all there.
What could it do for me? Not me. When I say me, I mean all of you too. What does it do for the patient?
So,
in terms of care.
So we don't repeat tests. We coordinate better. We don't make nearly as many mistakes as we did in the past. The outcomes are better. I can make the care better because there's a synergy between us and the specialists now. The primary care doctors actually, I think, are in an enhanced role now too. I think we're in a better position to coordinate care than we were when I first started out.
You know, our sister program that'll soon be seen on the air called Think Tank is going to be doing a program on the future of healthcare. And one of the subjects that we're going to be bringing up on Think Tank is a question of the role of patients in their own care. There is a process whereby patients can access this information. What's it, Jackie, call it? What's it called? My chart? What is My Chart? So
My Chart, we use the Epic electronic medical record system, and that's their patient access, their patient portal. So you can access My Chart, which is very easy to sign up for. You can make an appointment with me. You can check your labs. If I did a test with you in the office or I sent some blood on you in the office, I can send you the results with a message that goes along with it.
So it's not me, sorry for interrupting. Is it not me? I'm not interpreting clinical language. No. I don't understand. I'm sorry, I interrupted you.
Not at all. No, but you can ask me a question through My Chart. I can answer you through My Chart.
Right.
There's a lot more connectivity. People have a lot of medical information. People come to me with what they're worried about.
Do we want to be more involved in our own care, doctor, from your perspective?
I think so. I think people like a little bit of information. They like the control. What a lot of the internet doesn't provide. It provides a lot of information, but it doesn't help you interpret it and make sense of it for that particular clinical situation.
And we could also look, I've looked on the internet and I was like, oh my God, I have what? And my doctor will say, stop looking on the internet. You don't even, that's not about you.
The internet gives you all the possibilities.
Yes.
What I was trained to do was to make sense out of what you told me, make sense out of your physical exam, make sense out of the labs, and then come up with a cogent diagnosis. Yes, there's some bizarre diseases that are always a possibility, but they're not likely. You know, people come, frankly, they come scared now because they looked on the internet and they saw all those
and you have to manage
terrible
that.
diseases.
By the way, Jackie, there's a new office you just opened up in
Cliffside Park.
What is that office and why does it matter to patients?
So this, I think, is the next is the office of the future. So we built a brand new office in Cliffside Park at 6,000 square feet.
That's in northern New Jersey. If you don't know, you're watching us in a lot of different states. Go ahead.
Yep. So it's primary care and specialty. So not only now can I interact with the specialist via the electronic medical record, he's in the same office with me.
He or she. Right.
He or she. I can walk right over and say, what do you think about this? Take a look at this. The patient, it's good for the patient because not only is the communication there, it's a familiar office to them. They're familiar with the office staff. One of the things we can't lose, Steve, is the personal touch. We can't abandon neighborhoods. We can't build mega centers and expect people to come. People still like that personal touch. That's one of my challenges in my job right now is, yes, the technology's great, but you can't lose the personal touch.
It's a combination of technology, personal touch, and also sharing of information.
Absolutely.
Dr. Brunnquell, I want to thank you so much for joining us. We appreciate it.
My pleasure.
We'll stay on top of this.
Thank you.
This is One-on-One. I'm Steve Adubato. We'll be right back after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 30 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the New Jersey Education Association, the Turrell Fund, supporting Right from the Start NJ, the Robert Wood Johnson Foundation, the Port Authority of New York and New Jersey, the Healthcare Foundation of New Jersey, Guarini Institute for Government and Leadership at St. Peter's University, and by Suez, transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.